Hi, everyone. Vicky with King County Public Health, your host and community navigator. Today, we have a Q&A info session today with our special guest with Dr. Heather Flynn and my co-host, Fernando Luna. Please, let's do a little introduction about each one of you before we go into questions.
My name's Heather Flynn, and as you said, I'm a primary care physician. I work at the public health primary care site that's embedded within Navarro's Mental Health and Wellness in Burien. Thanks for having me today.
My name is Juan Fernando Luna. I'm the Civic Engagement Coordinator for Entre Hermanos and El Latino or Latinx LGBTQ plus community here in Seattle.
We're going to go ahead and go through our questions around COVID-19. And our first question is regarding masks. Why do vaccinated people need to wear masks in indoor public places?
So there's two reasons, because there's two things that we've learned about the strains of COVID that are here in our community now. One is that even if people are vaccinated and they do not have symptoms of COVID, they still are able to transmit some of the COVID virus and spread it even if you're not having symptoms. So wearing a mask helps protect any spread of COVID within an indoor setting. The second reason is that as COVID has changed over time, the virus has changed over time, this particular strain is more contagious. And so it is easier for it to be spread. And that is one of the reasons that we're now requiring that masks be worn in indoor settings to help prevent a further spread of the COVID virus.
Why is it so important to wear a mask, and what we can do to handle a situation when we are indoors or in a massive outdoors space? How we can handle the situation with those people who really refuse to wear a mask?
And first, I just want to say that that it's really tough to adjust to all of these changing recommendations. And I think that's one thing that we can all just kind of empathize with, right? It's hard when the rules change very frequently. In healthcare, we're used to science updating what we do often, but not so much in public rules like this. So it's a lot to change very frequently. A couple things. I mean, one is just that masks are required, right, in indoor settings or in larger group settings. The health department, really, part of the job of the health department is to help make decisions about what the safest environment is in public settings. And part of the reason that we require masks is so that a public space can be as safe as possible for young children who can't be vaccinated, for staff who are working in that setting every day, for adults who may have been vaccinated but don't have strong immune systems. So when we enter a public space, we want to know that it can be safe for everyone. And that's part of the role of the health department to help make those decisions. And really, as a business owner or someone who's managing a larger event, it's totally okay to refer to that rule that just it's required, right?
Mm-hmm.
We don't want restaurants making their own decisions about whether or not employees have to wash their hands before they prepare food, right? Like, it just has to be done. And this is kind of the same thing, that at this point, this is information that we've learned. This is how we keep our community safe. It's how we keep businesses open and staff healthy and families healthy. So I think just respectfully, setting that boundary, and that it is a requirement that everyone needs to follow, and that as a business owner, an organization, you have to enforce.
Right now, we're going to go in some questions regarding the boosters. Will boosters be needed for everyone, doctor? Will boosters be needed for everyone?
That is a great question, and one that lots of us are asking right now. What we do know is that right now there is a very small group of people who do benefit from a third shot of some of the COVID vaccines to really get a good response to that vaccine, to get really good protection from that vaccine series. So right now, the people who benefit from a third shot are people whose immune systems are weakened for a number of reasons. Might be because they've received chemotherapy, it might be because of they've received medications that cause them to be what we call immunocompromised, meaning their immune system just isn't as strong. And so their immune system kind of needs an extra exposure to that vaccine to get a really strong response and good protection from it. In the next couple weeks, we expect that we will get more information about whether a booster shot is recommended for everyone. We anticipate that will be around September 20th that we'll have that information. It's at this point, it does seem likely that there will be a recommendation that at some point people do get an additional shot to help keep up their protection against the COVID virus.
Okay, thank you, doctor.
I have a question. How do we know it is time to get a booster shot?
So people who fall in that category of being immunocompromised, like I mentioned, those individuals should get a shot, a third dose of that vaccine now. That's available at any vaccination site. If you were someone who received one of the 2-dose vaccines, what we call those mRNA vaccines of Pfizer or Moderna, you are able to get a third dose of vaccine already. For others who are waiting to find out if it will be recommended, we anticipate that the Center for Disease Control will help make that recommendation in the end of September. And once that decision is made, you can always look at kingcounty.gov, the COVID website there, the Washington Department of Health's website also provides updated information about vaccine requirements, or you can call the call center line that Vicky mentioned to get information about when that vaccine might be recommended for you.
Thank you.
And I also will say that often the best source of information is your primary care physician or your primary care provider. Whoever your trusted healthcare provider is, likely is the best person to give you information about what's recommended for you and when.
Children are going back to school. What can school districts can do to keep those children as safe as possible with the current Delta wave here in Seattle County?
Yeah, so what has been different about Delta is that the Delta variant of COVID is that we do see that it impacts kids differently than earlier versions of the virus. So it's natural that parents and community members and teachers are worried about how do we keep schools safe. We also know that kids really need to be in school, and we want to help make that as safe as possible, right? We use lots of different layers of protection to make any place safe, but especially schools. So one is having staff and kids who are able to be vaccinated receive the vaccine. And that is a requirement of teachers and staff of schools in Washington, that they've been vaccinated against COVID. We also recommend that students and any staff members be wearing masks when in schools. We know that masks really help prevent spreading the COVID virus, and that's very effective. Schools also have done a lot of work to help make sure they have good ventilation, that there's good airflow in their rooms. They've done a lot of work to help change some of how they do things to have enough space between kids, especially say in gym class or when they're having lunch. So there really is a good mix of things that are being used. But the biggest way to keep kids safe is to keep the people around them healthy and to prevent really introduction of COVID virus into their community and school and at home. So as a parent or a caregiver of a child, probably the most important thing you can do is get vaccinated.
We have one more question regarding schools. It is almost time for the flu season. So can I take the flu and COVID-19 vaccines at the same time, doctor?
Yes, you can. You absolutely can get them at the same time. You also can get them close to each other. Some people prefer to get one and then get the other, but they do not need to be spaced apart. We also anticipate that we will see, or we could see more influenza this year because people are going to be out and schools are back in session. And so we'll be mixing more with other people, and that's part of how flu is spread. So it is really important to get that flu vaccine this year.
Thank you so much. On behalf of Dr. and Fernando and I, Vicky Navarro, with King County Public Health, we thank you for watching our info session regarding COVID-19. If you need information around COVID-19, please call our call center at 206-477-3977. And thank you again.